Welcome to Bastyr Sports Medicine Club's taping of the ankle. First, apply the pre-wrap. Here you can see two pads being placed, typically with a sticky backing to help prevent blisters from forming. Next, apply the pre-wrap over top of these sticky pads. It is best to prevent any pockets or folds in the pre-wrap, as this will trap heat and then trap and cause a blister underneath of the athletic tape. Cover all aspects of the foot that will be covered with the athletic tape. As you can see now, a fold is being created and should be removed. Once the pre-wrap has been applied, remove any folds that were formed in this process. This can be done by just simply tearing away any of the folds while still leaving the remaining pre-wrap in place. Next, apply the anchors with the white athletic tape, typically applied at the top of the pre-wrap area and near the toes. You can apply 2 to 3 rounds of the tape for the anchor. These anchors are used for starting and stopping places for applying other techniques of the athletic tape. Next, apply the first technique called the stirrup. Starting at the medial aspect of the leg from the top anchor, apply the tape down across the heel and up to the lateral aspect of the top anchor. 2 to 3 stirrups can be applied, overlapping the lateral and medial malleoli. It is important to remember that the patient needs to stay in dorsiflexion during this entire taping process. This helps prevent and keep the ligaments of the ankle in close proximity. Make sure that there are no folds in the athletic tape. The next technique is applying the horseshoe. This is designed to stabilize the heel. This is an extra technique that isn't always needed, but can be helpful if the athlete is requesting more stabilization of the heel. The next technique is the figure 6 application. Just like the stirrup, start at the medial aspect, and then instead of going to the lateral side to end the tape, you will end up right where you started, making visually a 6. The important part of the figure 6 technique is that as you cross the foot, that the X formed is over the joint space, as you can see with the tracing. The figure 6 technique helps prevent excessive plantar flexion, and when applied in a cross pattern, excessive inversion and eversion. Again, important to remember that the patient needs to keep their foot in dorsiflexion while this tape is applied. Here you can see the other opposite figure 6 technique being used, starting from the lateral aspect and ending back on the lateral aspect, creating that X over the joint space. As you can see, if the foot is not kept in dorsiflexion, the athletic tape can become slack or loose, and may not provide the best support for the athlete. The next technique is considered a heel lock or a figure 8 taping. Essentially, the tape is applied slightly covering the medial aspect of the heel, brought around to cover the dorsum of the foot at the joint space, and back around to cover the opposite medial aspect of the heel, and brought right back around to the joint space. Next comes the final wrap. Remember, when applying the final wrap, start distally as much as possible, moving proximal to help the circulation of the foot, keeping blood flow moving back to the heart. Often you can move right to the final wrapping after completing the figure 8 technique. The importance of the final wrap is to cover any of the leftover pre-wrap to make sure there are not any windows left over. Again, windows can help create heat, which then can cause blisters or abnormal friction when in the shoe. Be careful to prevent any folds in the athletic tape, as this extra bump can again create blisters. If the tape was applied from the proximal to distal, it may cause swelling in the lower extremity of the foot and cause pain. Trim any of the tape that has been folded if necessary to prevent blisters. It was always important to test the tape job with the athlete, instructing the athlete to practice the movements that they're going to be performing while the tape is placed. This is helpful to get their perspective if the tape is too tight, too restrictive, or limits their motion too much. When removing the tape, it is best to use blunt edge scissors to not poke or cut the athlete. There are many dedicated tools to removal of athletic tape. It can be helpful to use the softer aspect of the plantar surface of the foot to guide the scissors with one hand, or along the calf. Taking note to avoid areas such as the lateral or medial malleolus or any other bony prominences, as this will be uncomfortable to the patient. Check out our other videos at Bastyr Sports Med Club on YouTube.